Okay, so good morning, all of my dear viewers. In today's session, we are going to discuss about the biomedical waste. So, what is this biomedical waste? Any medical procedure includes diagnosis, treatments, or the immunization. Whatever the waste generated during this medical procedure, they kept under the biomedical waste. So, for convenience of disposal of biomedical waste, we separate this biomedical waste into the four categories on the basis of color codex. I mean, there are four separate container for thrown the different types of biomedical waste. One is the yellow container, blue container, reds and whites. So we are going to discuss one by one. First, we start the topics with yellow container. I mean, which types of biomedical waste we thrown under this yellow containers. So in yellow container we thrown the anatomical waste like the placenta we obtain after the delivery, amputated parts of the body, all the soil waste including dirty clothes of the patients, expired drugs, and the microbiological waste like the culture media and the culture plates, liquid waste like blood and sputums, and the cytotoxic drugs. So these all are waste which we thrown in the yellow categories. For disposal, we go for the incineration. I mean burn them in the presence of oxygen. Okay, so now in red categories, which types of waste we thrown? In red categories, we mainly thrown rubbers and plastics, except the blood bag and nasogastric tube, because these blood bags and the nasogastric tubes, they are highly infectious. So we not take any risks for the recycle or the reuse. So that's why we put this blood bags and the nasogastric tubes under the yellow categories, and in yellow categories they undergoes incineration, so completely destroy by burning. So in red categories we mainly kept rubbers and plastic bags except the blood bags and the nasogastric tubes. What are the disposal methods? Since it is a plastic, we know go for the disposal, we sterilize them by autoclaving and recycling. In blue categories, we kept glasses and the metallic instruments and the metallics implants for disposal. For glasses, after the autoclaving, they undergo the recycle stage, and this metallics implants after autoclaving, we can reuse it. The fourth category is the white categories. Mainly, it includes the sharp things, but not all the sharp things. So what are the different sharp things included under this? Fixed needle syringes, surgical blades, and the needle, any types of needles. So what are the how we dispose it? Sterilized by autoclavings, then shredding, I mean crushing these needles, and they recycle it. Not always burn the needle before throwing into the white bags because they have a high chance of infection. Okay, so always burn the needles before throwing into the container because they having a very high chance of infection. So this all about the medical waste.